good? Volume good? All right. Good morning, everyone. I'm so thrilled that you've, chosen our session. We good to start? Yeah. Okay. Welcome to our session that we are calling Designing and Implementing Programs with Residents and Families at the Center. My name is Cara, Ianni. I work for the King County Housing Authority, and this presentation is actually a collaboration between two entities, the King County Housing Authority and the community builders. Well, how did we come together for this? Well, Ted and I from KCHA were reading the program brochure for the Narrow Awards of Merit one year, and we saw this description of a program from the community builders and their health champions and their resident leaders. And we knew that we were just starting to design a program. We wanted to have our own resident leaders. So we reached out to Jody here, and long story short, she flew out to Seattle, and for like a full day and a half, we just picked her brain about what to do and what not to do. And so we have kept in touch ever since. And so today we're here to share our broader, our learnings to a broader audience with you. So I will go ahead and pass this over to Jody. We're all just going to introduce ourselves when we first speak.
Thank you. I think you can go to the next slide. Next slide, perfect. Thank you. So I'm Jody Cunningham, obviously. Thanks for that introduction, Cara. I am the Director of Health and Housing for the Community Builders. We'll talk a little bit about that, I think, in a second. Oh, go back one. Thank you. No worries. So we are a nonprofit real estate development organization. We have a hub in Boston, but we're also regionally based. I sit in our Cincinnati, Ohio office, and the initiative I'm going to talk about today is based out of the Cincinnati Avondale neighborhood, which you'll be experts on by the end of this. We have our community life department, so that's really our resident services division in-house, and that's where I sit. Really, the mission is to use our place-based model to use healthy and stable housing as a platform for connecting our residents to community resources and opportunities so they can thrive, all of the work that you all do. And we do that by creating programs and building strategic partnerships with residents and local stakeholders. So really zooming in on the resident component of that. We're in a new, it's not new anymore. The years have just flown by. We're in a strategic plan right now that started in 2020. So we're halfway through that. But part of our strategic plan is keeping residents at the center of all we do. And this is just one of those kind of shining examples of how we try to do that. Next slide. So here's just kind of the big stats for our community life department. We are in 54 communities. We provide over 5,820 homes where community life exists. We serve over 12,000 residents. We're in 29 cities, 12 states and DC. All of that is east of the Mississippi. So we love our West Coast partners. We don't do anything out there, but we love to partner on really great things. And then we have lots of partners as well. Next slide. So we're going to show a video first. Cara already gave us the health champion name. So you're really just going to see that in action first before we describe what those residents are actually doing.
These home cooks are being put to the test.
This is everything that I dreamed of.
But are they up to the challenge?
I go from flustered to panic.
We want to fall in love with your recipes.
It's go time.
Follow 10 cooks from across the country as they prepare their unique family dishes, judged by celebrity chefs.
That is a perfect recipe.
And compete to see who has the Great American Recipe.
Ready to cook your hearts out?
The Great American Recipe starts June 24th on PBS and the PBS app.
Even with advances in medical technology and living standards, the United States still ranks near the bottom of the world's wealthiest nations in infant mortality, which is children dying before their first birthday. John Yang reports on efforts to address the problem in Cincinnati, which has one of the highest rates in the nation.
You ready to put your shoes on?
In Cincinnati's Avondale neighborhood, it's a typical morning for Ashanti Davis.
What's this color?
Getting 4-year-old Royal ready for daycare, while also tending to King Adam, who was born in October. Arriving to lend a hand and offer advice,
Hi, Miss Brown.
fellow Avondale resident Tina Brown.
Yes, lay you down on your back.
So you've been keeping the baby in the crib? You ain't been sleeping with the baby, have you?
No, 'cause I don't want to roll over on them.
That's right. So you
Gotta
got
keep
it
him
down
safe.
flat, well, this came across my desk.
And she has a tip on a hospital job for Davis, who currently works for the Cincinnati Parks Department.
Hospital worker readiness program.
During both pregnancies, Davis had gestational diabetes.
Hi, sweet Miss Conti.
But with King Adam, she had Brown at her side, counseling her on diet, going with her to doctor's appointments, reminding her to take her medications.
Good job with your diabetes, though. You're doing great.
Thank you. With this pregnancy, it was easier, me knowing that I had somebody to help me out and stuff like that. And every week she came with some type of resource.
Tina Brown is part of a broad effort shaped by mothers and focused on mothers to reduce the rate of infant mortality across Cincinnati. As recently as 2011, this county had the second highest rate in the nation. And despite a 15% drop over the last 5 years, it still ranks in the top 10%.
We're ready to go.
Okay.
The arrival of King Adam didn't signal the departure of Brown from Davis's life.
That's cute.
On this day, Brown went with her to get clothes for both children at a pantry run by Carmel Presbyterian Church.
You should get these for her.
I need to see them.
I call her every day, see how she doing. You know, just kind of see what kind of mood she in. We got a close bond. Me and Ashanti got a real close bond.
A year ago, the women were total strangers. Brown was matched with Davis as her advisor and advocate, what's called a health champion, by the Community Builders,
Got it?
the nonprofit development company that owns the building where Davis lives.
King's going to the doctor regularly.
Brown is one of 9 health champions the company employs. Altogether, they currently counsel 64 families with either a pregnant mother or a child 6 or younger.
Through housing, we have a unique access point.
So you saw the video first, right? Now we're going to unpack it a little bit. So we did that work through housing, which is pretty important for this conference, right? We partnered with the Cincinnati Children's Hospital and then also the Cincinnati Health Department. And through that cross-sector collaboration, we were able to receive funding from the Build Health Challenge to test this 2-year pilot to combat infant mortality, not only through this one-on-one support and community resources that you saw, but also through policy and systems level change too. The first system change being that we are hiring resident champions through housing. And I'll talk a little bit more about that later, but also the health champions were able to work on policy work. So we were focused on all of those things that are important to mothers and children to really combat infant mortality, like I said. So they worked on early literacy, connections to preschool, getting connected to primary care within the first trimester, getting the kids to the doctor, safe sleep, you saw some of that, and breastfeeding. But not only that, this is really resident led and resident centered, not only what the health champions were saying, but also what the residents that were receiving the intervention were saying that they wanted help with. That was really important. And the whole point of this, the whole reason that we were partnering with health entities and housing was to really try to build trust there. There was a lot of mistrust with the healthcare systems. Talk about that more later too. But the health champions were really able to expedite that process because you're providing support and you're working with someone who literally lives down your hall. And we saw that that was a real model that we wanted to expand on and collect a lot of data on just the pilot part of that, which I'll talk about in a little bit too.
Good morning. Dr. Ted Dezember. I think it's the first time I've ever addressed myself as doctor. I just got it. So thanks. Yeah, so a little bit about KCHA. So you see our mission there. Well, it's kind of hard to read, but it's as a national leader in affordable housing, King County Housing Authority serves to provide innovative, effective, and equitable housing solutions so that all people and communities can prosper. So the education team is kind of at the forefront, I think, of this mission. Just a little bit about our housing authority. We were established in, I think, like 1939. We became a MTW agency in the mid 2000s. We are kind of regional housing authority as King County. King County is the largest county in Washington State. 37 different cities across the county, something like 19 school districts. So pretty expansive space and lots of people. We serve roughly 42,000 people in, I think, our public housing stock and oh no, sorry. So together we have 42,000 people and 15,000 children. So that's through public housing and housing choice vouchers. So that gives you a little bit of sample size there. 33% of those families are elderly, 29% are non-elderly with a disability, and 40% of them are families with kids. So it's a high number of kids. And just an interesting fact, I think some of your housing authorities may also look similar. As 2020 data, 45% of our families entering programs were exiting homelessness. So if you think about kind of the portfolio and the people who are kind of moving in. So that's just a little bit about our size. Next size, please. Slide, please. Oh, sorry, that's so hard to read. I apologize. This is just a quick snapshot of how KCHA and my team, Cara and I, try to advance different strategies or programs. And we talk about these buckets or kind of spheres of influence or something like that. What are our levers, really, right? And so we think about access to families as being one of our primary levers. We think about infrastructure. So where are the buildings? What are the buildings? What is the use of the community space? Early learning centers, out of school time programs. So we've invested over the last 20 years in creating those co-located spaces across our portfolio. And then the last is around policy and advocacy. And so how are we trying to push on the issues? How are we trying to innovate? How are we trying to lead? And so I think this program is hopefully a nice kind of example of kind of how each of these levers are being pulled. And just to share, like taking a step back, kind of these are ingrained in everything. So it's like if you pulled out any strategy or anything that we did, hopefully you would be able to kind of see these levers. It's kind of the red twine that binds everything together. Next slide. And so the Early Learning Connectors program. Just again, quickly taking a step back. This program was an intentional co-design process that you're gonna hear a lot about, that Cara is gonna walk you through. This was a new approach and new strategy for me as a leader, for our team, for the Housing Authority, I think really in general. And the idea was, it was pretty simple. We have money to do something in early learning. We, through our funding, to get the money, we said, these are the things that we want to focus on. We want families to have the information and tools they need to support raising their small children. We want kids and families to have opportunities to participate in high quality programs and services. I think there's a word missing. Relevant is a word I like to put in there. So culturally and linguistically relevant as well. And families strengthen the relationships with their neighbors. And so that's what we walked into the space with. Money and that. And this is what we have, this is what we're after. What does that look like? And so Cara is gonna kind of walk you through that. I think next slide.
So some commonalities, you can imagine how we love getting together with each other because we're both engaging in these very different initiatives and also very similar in so many ways. So these are just some of the things that we found, what we knew before the design process. I talked about mistrust of the systems. I talked about the healthcare system. Our work was really focused on health. Theirs more so education. However, you all know it all is intertwined. So we're all working on all of that stuff. But not just the health system, mistrust of the housing system is a really important thing to name out. So what we've found is that in Cincinnati, at least, our health champions are able to reach residents and connect with them in a very specific way. The pandemic highlighted that more than anything for us. When everyone was sheltering at home, our health champions already had relationships with residents and could go there and drop food off and say, this is the COVID vaccine. This is where you can get one. This is what I know about it. I got mine, that kind of thing, where no one else was reaching residents in that way because it wasn't safe to go outside, right? But that was really, we know housing is health, right? I've seen it somewhere here today. But that was our point to really say, no, housing really is health, and this is why. And resident leadership can be health too. And why is housing an important piece of that whole healthcare and public health puzzle? So we have that unique asset, reaching residents through housing. Also, it can be a deterrent because it's my landlord, right? So who do you work for? You're a health champion. Are you going to go and communicate back with my property manager and tell them everything that's going on with me? So it's really, we spend a lot of time crafting what does it look like for the team to have agency over messaging. They have their own t-shirts. They don't have badges that say the community builders, but they have their own t-shirts that say, community life, and it's vibrant and it's all of that type of stuff. But we wouldn't have known that if we didn't share power and do some leadership skill build and learn from them, really, in that sense. And then we've also found there's a lack of coordination between systems.
Next slide. Oh. Yeah, so in Washington State and maybe in similar states, right, the 0 to 5 space is the Wild West. There are no necessarily systems that interconnect everything and speak to each other and things like that. And so that was something that we knew existed. We see all the time. In our county, I use a saying often that we're service rich and system poor. And so we knew that existed. And in our local context, even more so highlighting that fact, there was a very large county-wide investment called Best Starts for Kids that flooded the space with money. And the intention of that was funding many community-based organizations, BIPOC organizations, things like that, folks that traditionally had not been getting access to funding, and which is a wonderful thing, but also, right, there's no systems, there's no interconnectivity. So we knew that there was going to be a lot of opportunity for people, but how were they going to access that? How are they going to find out about what was happening and things like that? And then also, misinformation, lack of information, lack of access, and isolation. So, we are a large housing authority. As I said, some of our sites are further out, some are kind of on their own. So there's the literal geographic isolation sometimes that's involved kind of in public housing. But then also, if there are moms and dads in here, you also know, being parents of young kids, there's isolation and things like that too, right? You often feel like you're alone, and it's scary, and all these things are happening. So, right, just kind of highlighting that fact that bottom point was, it happens kind of on many different levels for families. Go to the next slide.
Just wait a second. So we hired the residents. That's an important piece. We didn't know that that was really innovative, but it is innovative apparently. So we hired them as the housing provider, not the healthcare institution that we partnered with, not the health department, but the housing organization. We'll talk about the differences in how we did that, but it was really going back to the power that I talked about. Not only did we hire them, but they co-led and helped develop the strategies and interventions we were going to use to engage with residents. So something that we found, you heard me mention, we addressed early literacy as a way to impact infant mortality. Like, how does that make sense, right? But what we found was, if you go into a household and say, I want to talk to you about preventing infant mortality, they're probably not even going to open the door, right? But if you go with a children's book and say, here, I want to give you some books to build your at-home library, that's not offensive. It's fun. It's, not threatening. It's a really nice way to start to engage with people and to build trust. So that was a really key area for us, was that early literacy component. So that's also always not fun, co-leading with residents, and it's not always easy work either. And there's really critical discussions that have to be had about, pay and managing that and their own professional development. And I'm going to talk about that later too. But the thing is, it's important. And I think it's our job to use our resources, use our leverage when we are in tables, and consistently pull them, to the table with us, because they are experts in the community. They're experts on Avondale, for our example, and they need to be paid for that work. So I think it's great now, 4 years later, we started hiring them and we paid them, but also they're really immersed in a lot of our community partners, coalitions, and networks, and they're getting paid for that work too. They're also part of a grant review team for Cincinnati Children's Hospital, gives a community grant out of community benefit dollars. Our health champions are part of the review team to say who should get funding. So that's what I mean by shared power. And it requires a lot of support and navigation to support your team to be successful in those kind of spaces too. So this is a quote from one of our original health champions. We've had like 3 cohorts now, so they love to call themselves the originals. So she said, "It's a gift from God that I've been doing this work. I know my purpose and my testimony. I didn't know I could get paid for this work. It's just my story. I just want to be the mother in the community because I was them and they are me." When I met her on my very first day working at the community builders, it was pouring down rain. She was there with a new mother that had, a stroller and 2 children there. She met me. She was obviously very welcoming, because you can tell by her quote, but she was saying how she was taking this mom up and down Reading Road, that's our corridor, showing her all the places she needed to go to get support. She was introducing her to everyone, walking in the rain, just out of the goodness of her heart, because she wasn't hired on, she wasn't getting paid. That's just her life. That's just what she does. Those are the kind of people that we have as our champions and connectors. Next slide.
So I wanted to share this, as I think it's a nice visual representation of the shift, particularly in my thinking and leadership, and I think also of my team, leading the team. So this is cited from a new book where it's recently published called Just Schools by Dr. Ianni from the University of Washington, who was my advisor and teacher and mentor as well in my doctoral program. But you know, I mean, it's no mistake that this program was created while I was in this learning mode. I think for me, I really wanted to think about how, as a leader, can I shift my approach, my leadership strategies? How can we do things differently? And so I hope that we did some of these shifts. And so what you can see, kind of one column there, and this is in the state of schools. But I firmly believe almost in every conversation, you can substitute schools for housing authorities in all these partnership conversations and things like that. That's my background. I was a school administrator and a teacher and all of those things. And so it's the same. Right, in conventional partnerships, it's really kind of the more atypical or typical, maybe transactional type. What we heard yesterday from the gentleman at Martha's table, you know, doing things to people. So our mantra is nothing for us without us, right? So how are we at the very beginning being thoughtful and bringing in the people that are going to be served by the program at the very beginning? And so I hope that the shifts we made show up more in the equitable partnership side. So you see things like non-dominant family, parents and families as leaders who contribute and help shape the agenda. That there's equitable systemic change within a culture of shared responsibility. That we build relationships and capacity for systems change, and formal leaders bridge. And then in the change process, change is a political process that addresses broader issues in the community versus a typical change process that would be, you know, like we're just going to solve the problem and we're going to implement it and this is what we're going to do. And so Cara is going to kind of walk you through our process, and I hope you can kind of see how we try to bring some of this to life.
Okay, so in the next several slides, I'm going to give you all an overview of our co-design process. And I'm going to be attempting to distill 20 plus hours of meetings into a handful of slides. So I'm going to throw a lot of information at you really quickly, and just know if you've got questions that we're around at lunch, if we don't have a lot of time for Q&A for this, or contact me later. But basically what we did is we invited our families that were the target families for our Early Learning Connectors program, which involved 7 of our public housing sites and targeted families with children that had yet to enter kindergarten, so 0 to 5 essentially. And we invited them to a series of meetings. We provided not only food and childcare for all ages, we also provided gift cards as a way of compensating them for their time, since we weren't actually able to write them a check. We gave them gift cards. And our process really started with very broad questions, which I'll share in just a moment. But then we drill down and even more, and tell me more about this. I'm going to walk you through that process now. So I'll go ahead and next slide, please. We used a community cafe-ish structure. Starting with these just broad questions. What do you think parents need to know or be able to do to raise their young kids to be healthy and happy, right? Well, where do they get that information? How do they learn those skills? What do you feel is hard about parenting small kids? And finally, what are the strengths that you bring, you know, as a parent to parenting small kids? So this is really how we started. Some of these parents knew each other, some didn't. So we had like broad table discussions, you know, around these questions. And what they really did is they helped to provide at least some framework around the focus of early learning, say, rather than starting with the very broad hopes and dreams. not to say that the answers didn't cover all sorts of things outside of necessarily early learning, but it helped to frame things. And basically throughout the process, the table groups recorded the detail, like individual responses, and then they would share summaries and common ground, while KCHA staff then hearing all this, the staff who were trained in facilitation, were harvesting the information, synthesizing it, and relaying it back to the group to vet and make sure that we got it right. Go ahead, next slide, please. So these are just pictures kind of captured from the process itself, but just a small portion of what we discussed. I mean, essentially that first session ended up with the question of what has the most impact on children entering school, happy, healthy, and ready to learn. And some of the responses that you may or may not be able to read on this slide, included accessible programming, parents' knowledge of early childhood development, the family's financial resources, right? And also the time that parents have to spend, and not just with their children, but for themselves and also to support their culture. I came up a bunch. Go ahead and next slide, please. And so we asked families to really prioritize, what of all these things we've been talking about, you felt the most impact. And you can see on the left part of the slide here, those are those priorities. And what we did for each and every one of those priorities in our next sessions is we did a form of factor analysis. Now, there may be some of you proud math nerds out there that are like, factor analysis, you did not do a proper quantitative factor analysis. No, I know we didn't. We did a very simplified kind of social science form of it. But for each of these factors, we asked families, okay, for example, for time, that's what's actually on the right end of this, is time, that quality time to spend with children. What are the things that positively contribute to the amount of time that parents have to spend with their children? And what are the things that negatively contribute to the things? And so some of these things that you may not be able to read on there, but the positive things had to do with things like free programming, flexible jobs. What we heard from parents and families about what negatively impacted the amount of time were things like parental mental health challenges, and also lack of information on free and low cost programming. And there's many, many, many more things listed on here. And so then we drilled down actually even more. And so we had these, factor analysis for each of those 7, high impact things on early childhood development. And then for each of them, we asked our families to identify, okay, well, which of these factors do we actually want to spend some time working on? So if you think of the positive ones, what ones we want to work on boosting, so we have even more of, what are the negative impacts we want to work on reducing? Next slide, please. And so out of those came this list right here of what we like to term like community priorities. And so these included more parenting classes, more and better programs, more access to financial resources, less bullying of kids, more of trusted people who can explain things in residents' own language, less racism in systems that support only white people, and more counseling and substance abuse help for parents. And so these are the things that really came out of all of that. But then we drilled down even more. Next slide, please. So you saw parenting classes on there. One of our next sessions was, what does that look like? Okay, you want parenting classes on site? Okay, tell me more. You walk into the room, what do you see? What do we need to have to make that successful? And we got a long list. We want this, we need that, so we have all of this, volumes of paper, we have forests of detail on, what, on each of those priorities, that they want, that our families wanted to see from this program. Next slide, please. And our final process of this portion of the co-design was to use these copious details to create both a program description and a job description. And so what we did is KCHA staff created the first draft, and then we brought these drafts, to our families, the pens to mark them up and add, delete whatever they edited these. And so in these job descriptions, you'll see captured some of the broad community priorities as well as some of the minute details on there. And so, one of the things on here is coordinate events, including parent classes, community building that would include culture sharing, gifts for birthdays and for newborns, all these things that we brought together. And so next slide, please. Here we are. We actually did this in 2 different communities. This is the Kent group. And actually in this picture, you can see 3 of our connectors. We start from our initial originals cohort. And so, here we are working on those table groups, and it was it was quite an experience. So, overall, we've harvested a huge amount of information on residents' needs and desires for their small children. And we continually use these data. I'll tell you more later about the structure of our program. We meet weekly, and we also meet quarterly. One coming up next week where I will pull out some of this information and be like, how are we doing on this? Because some of it, we're not doing so well because of the pandemic. This program started in February 2020. It was developed, we did this in the fall of 2019. So the whole idea of like community classes and all that, but we want to, remind ourselves of what the original, intent here and work towards that as much as we can safely. Next slide, please. Okay.
So we're at 10:45. Should have looked at the details. There. All right, lots of time then. We'll probably have lots of time for smaller conversation questions too, which I think might be some of the best learning. But we did want to, I passed out earlier, and I don't know if there's some folks that came in that didn't have one. Maybe a few people. So one, I want to make sure Jeff Edmondson or Josh Davis are not in here because this is a RBA, results-based accountability exercise. And I adapted and modified a little bit. So it's not, just want to make sure they're not in here to guilt trip me. But this factor analysis, if you are familiar with like that results-based accountability framework and leadership framework, right? Like this kind of lives in that space. The idea is, right, like what are the factors influencing negatively, positively, and then exactly what Cara walked you through, right? Like what are the factors? What's pushing those things down? What's increasing those? And things like that. And so we gave you just this little simple worksheet, just kind of a graphic organizer really to help you kind of think through how this might look or something you might want to take on in your own context. And so really the things you want to think about, right? Who's the target population? So if it's early learning, if it's maternal health or whatever it might be that you're working on, what's your current condition, right? So what's the data that you have for that? So what Cara shared, right? That was our data from our families. And then reflect, think, conversation, what's driving that down. So if you have a baseline that's lower than what you want it, what are those factors? What are those influences that are pushing that thing down? And then conversely, what are the things that support that? What are the things that could increase that? And then what are of those things can you reduce, and what are the positive factors can you increase? So we're going to take just like 2 or 3 minutes for you guys to have, you can turn around, elbow conversations. Think about if there is something in your context, like if this is resonating, if there's a problem, if there's a baseline data point that you're chewing on that you've been thinking about? What might that be? And then, maybe practice with each other just for a minute or two. Think about what's propping that up, or what's pushing that baseline down. So it's just the opportunity to stretch your factor analysis muscle here a little bit. So find an elbow partner or turn around, introduce yourself, and then if you have something that you're thinking about, and then just kind of walk through this together just for 2 or 3 minutes, and then we'll see if there's any questions or comments. So go ahead and reach out to a neighbor. Just like one more minute, folks. One more minute. No, I'm not teaching. You mean really teaching? You mean really teaching? No, I'm not really teaching. Yeah. What am I putting? Okay. Go ahead and wrap up your conversations. So, as I as I kind of jokingly said, when I was saying I hope Jeff or Josh weren't in here. This is kind of a I don't want to use the word dangerous. It's not dangerous, but like this activity, right? It needs to be done in the right context, right place, right setting, with people, right? I mean, you don't want to be in your office with your staff, right? Because we're right back where we were, right? So just to share that, make sure putting that disclaimer out there. Just curious, anybody have good conversation? Like, that was a great idea, or anybody willing to share out, or I can call on my boss, make her talk. Anybody have? Yeah. Yeah, I can restate the question. I'll try to summarize and tell me if this is not a good summary. But right, if you when you enter into a space with your residents, with your community, it's might be hard, or it is often hard, not to already maybe know where you want to go, right, or what that roadmap looks like, and what are strategies, or how do you kind of take a step back or just operate in that. I'll share from my perspective, and then Jody and Cara can share. Like I said, I probably we would have done something. It wouldn't have looked like this if I hadn't been in school. I'll just say that. I had like all of these people that I really respected, and mentors, and University of Washington telling me, stop doing that, and so that was one piece of it. And it's white, male, dominant. This is how I roll. This is how I've gotten to my point in my career, right? And so now entering into this space, we really didn't have more than kind of what I shared with you. We walked in and we said, we have money we have to spend on early learning. We know that. There's 3 pieces that we really care about from the Housing Authority's mission side that we want to be at the center of this. And then just structuring everything around that. And leadership is a big factor in that. My supervisor at the time and my now supervisor were involved in those conversations. HR was a part of it. Get ready, like this is coming, this is going to happen, this is what we're doing, how do we do this? And so it's like self-learning. It's kind of just taking a breath, trusting that there's usually more power and knowledge in a group than you have. And authenticity. I think I try to enter into this space as a not different, because it's the same person, But I don't know if Cara remembers, but I mean, I talked about my family, talked about my kids, talked about my wife, talked about how hard it was to be a dad. That's what I talked about. And I just entered into the conversation at that. And at first, there were for sure the hierarchical, but I would say by the end of it, in both in Bellevue and Kent, we developed really nice community. The fact that they were talking to a senior leader at the housing authority about racism was powerful and amazing. So I think a lot of it is like leadership and how are we entering into that space? What's the learning we have to do? What are the books we can read? What are the podcasts we can listen to? What's the networks we can create? Find your joke, and being self-aware that like, this is how I operate and this is my norm, and being aware of those things. I guess that's just kind of what I did, because it was hard. It is hard. It continues to be hard for me in some ways. I'm much more open and kind of going with the flow as long as we're all kind of marching towards the same vision than I used to be.
I'll just be really quick. There's a lot of good question prompts up there. I showed you what we started, but basically be there to listen, drop trying to solve the problem, drop being defensive. We had a 45-minute conversation about the laundry room in our Bellevue group. And we just wrote down everything and wanted to make sure that we understood instead of trying to fix it and instead of trying to make excuses. We need to let that conversation happen.
Such a good question, and you've jumped ahead. You're the A+ student already, because we were going to talk a little bit about this, but I echo what they said. But also, I think I have a little bit of a different perspective too. I think that our residents wanted something to react to. And I think you all did a bit of that in your prompts too. But we came together and had a funding opportunity. So we had some clear things that we wanted to work on. I listed those off. But I think where the magic kind of happens is that our health champions were trained to be able to talk about why safe sleep is important, to talk about some benefits of breastfeeding, to do those things, because with evidence, we know that that's important, right? But when they went into a home, like you saw with Tina and Ashanti, Tina would approach her for the first time and say, hey, how long have you lived in Avondale? Just like to start the conversation. They came up with that question. What do we want to start with when we do an intake form? And then where I said it's health champion led, but it's resident led too, is they said, what do you need help with? What can I support you with? And more often than not, it's not going to be one of those things on that list, but we're still going to try to address it. And that's where I think it's the beauty of listening to what the residents are saying. And then the health champion is going to come back to me as their supervisor at that time and say, or the manager, program manager, and say, hey, she needs a job. Like, we need to figure out jobs because that's what she cares about. Or there's no food in her refrigerator. So we can't really talk about, the importance of quitting smoking when she doesn't have food to eat for her family. So we need to focus on that. And we didn't just stop with it there, but we said, okay, well, let's let that data inform what we focus on next. And we did that. And I think that kind of, shared power, like that's what that looks like. Not thinking that we have all of the solutions, but really listening to them and the person receiving the intervention, not just the champion. Is it? Okay, perfect. We're on track. Okay, so I talked about the dual approach a little bit. So we have the cross-sector collaboration between our three key partners, us and our health partners. We are addressing the social determinants of health, which I chatted about, using the platform of housing as a springboard. Something that we found with our social service partners, such as community health worker partners that we may refer out to or something like that, was that they said, we spend so much time trying to find our clients housing. You guys already have that. You're already one step ahead of the game. You can go work on all of these other things, such as, getting folks into kindergarten and all of those things. So I want to say that that's an asset, and it's something that I would love for, housing organizations to uplift more and say, hey, I think it's a leverage point for us to be at those other cross-sector tables to say, no, we have this and we're going to work on housing stability. We know there's a crisis here, but partner with us, work with us, and that can really be a springboard for this transformation we're talking about. The system and policy change that the Health Champion team was involved in was really a sustainability approach too. So, our children's partner at Cincinnati Children's Hospital, they have a learning network where they're convening partners all focused on, child well-being and things like that. Our health champions attended that and were a part of that and were leading conversations in that space. They also attended the health department's coalition that they had at the time, Creating Healthy Communities Coalition, which is now renamed. But they were part of that, and they were active participants on subcommittees. And that coalition was really involved in policy. So through that coalition, they were a part of advocating for and passing a tobacco 21 policy in the city of Cincinnati to raise the minimum purchasing age to 21. They were a part of that. They were a part of advocating for, writing, and passing a breastfeeding friendly policy in 23 Cincinnati recreation centers, one of which is in our neighborhood, so that the community was more open and welcoming environment for breastfeeding parents in the community. What one of our conversations was, we're talking about the benefits of breastfeeding. We're coaching moms on this, but when they go out in the community is not supportive. So that's for nothing, right? So we tried to really do that dual approach in that way. Next slide. So these are some of the kind of levers, I guess we would say, for the Health Champion support that is required from our perspective. So we did do a core training. It was like a 13-hour training. We started with our version of what is your vision of a healthy family in Avondale. I think it's really similar to what your question was too, which is interesting. And they created vision boards. They cut out pictures and sayings and really created that vision. And they had big letters that said Avondale that they put those on. And that was really our guiding compass too, was their vision of a healthy family in Avondale and weaving that into the work that we did. We also had continued education through those partners. We leaned on those partners that had a vested interest in supporting residents in that neighborhood as well, which our two health partners did. So our team has had so much data collection training, survey development. They know how to write their own surveys. They're really comfortable with a lot of these skills that you may get in a professional setting, but not community-based and made for the community. So we pulled that in, and they had continued training opportunities in that. And then leaning more into what do they care about? We talked about infant mortality, but as a team, we watched a documentary about maternal mortality, very timely with the plenary. And they said, well, why aren't we focused on this? What can we do about this? And so we were able to get our team trained as doulas, which are labor support people. Not that we are doing a doula initiative through a housing organization. My legal people will hate me if we decided to do that, but they have the skills so that they at least know and can talk to residents about, childbirth education or what are your options and things like that. And then two of our health champions went on to participate in community health worker training, which was a platform for them to go on and have a career path if they wanted to. And then the barrier removal and coaching, we talk a lot about that piece. It really requires, that's one of the biggest shifts, I think, back to your question. In our organizations, we're not really set up to really support the whole person. We try, but we're not set up that way. And this required some innovative thought. We knew our residents had our champions struggled to get to meetings. They didn't drive, they just walked. So if a meeting wasn't in the community, our transportation's not great. Public transit in Cincinnati is not great. So we were able to get a Lyft business account where they could all have access to Lyft on their phones for some of those meetings. A nightmare on the admin side, right? So we're reworking that, but we did that. We had to do that. We had to think outside of the box for that piece. The same thing with childcare. So we supported them by having childcare available at every meeting. There was not a meeting we required the health champions to come to if we were not going to have childcare in another room in the space. It's critically important. That's the number one barrier. We had 100% retention after 2 years of our initial initiative, with 9 of our resident champions staying on for that whole time. That's kind of unheard of. And we think that one of those reasons was because the childcare piece. We fed everyone at every, event, and we had childcare there that was welcomed. And then the paid resident stipend piece. This is a policy piece that some of us have been talking about. We had to cap the resident stipend at $200 a month for policy purposes. If it's anything over that, you're all nodding, you know the policy, then it counts towards their income. We ran the numbers for one of our champions, Jennifer, that was quoted there. If we wanted to increase that stipend for her, what would it look like because she lives in our housing? She would be handing over that $200 directly to our property management team and would make nothing. She'd be back with that same quote she had, I didn't know this was a job. And we didn't want to do that. So we've capped it at 200, but it's a real area, my supervisors in the audience too. We were talking about how you were saying with inflation, that number has not gone up at this point. So I think that's a real area maybe for future convening and next steps. And then flexibility with the role. That's one of those tricky areas. We had our job description that was coaching moms and supporting them and doing all of that work. However, some of our champions had different skill sets and really didn't feel as comfortable going into the homes or possess different skills. So we now have different job descriptions within our own team of health champions. So one of those is an advocacy position where she's engaged in all of the policy and advocacy work, and we support her to do that. Oh, there we go. All right. Perfect. And so we were flexible with the roles. That's just the tip of the iceberg on what flexibility is required, because it's important to remember, just because they're part of this amazing team and they're getting this stipend, they're still very similar to the residents that they are supporting with through the program. So they may have some of the very same challenges that you are asking them to go and support the rest of the community with, whether that's food access or transportation or any of that. So if I could go back in time, I would be really clear on that in the beginning and supporting them more with their own career development and professional development. I think that's one of our biggest lessons learned and how we're shifting the program now. Next slide. So the data, the outcomes, it's not just a fancy program or fun, but we have some actual outcomes to share. So this is just from the first 2 years of the initiative. And we tried to highlight, Cara's team and Ted's team tried to highlight kind of what was the beginning process, which they did with the factor analysis, which is, I was like taking notes in my head about like implementing some of the stuff that you all did. We focused a lot of our data collection on the process of hiring resident champions through housing. What does that look like? So we have some of that to show. We have on this little pie, you'll see there's face-to-face engagement, phone call, or text message. So these were all, I'll back up really quickly. We had 2 forms that we create for data collection that the health champions helped design as part of the initial training. So we have topics discussed, referrals that were made, when is their follow-up, what time, and then a notes section where they love to write all of the notes stuff about the specifics of the resident. We also have the type of contact and the type of support that the health champion provided during that one-on-one session. So you'll see in this 2-year time frame, they spent over 2,000 total hours working with residents. They most of the contact was by face-to-face engagement. However, at one point, it's an iterative process. They said, hey, we're engaging with people in a lot of different ways, and we're not getting credit for that on our forms. We want to get credit for that. And I said, well, yeah, we want to know what that is too, because that's important to the process. So we've revised our data forms, I think 4 times. So blessings to our data people, because that's not what you want to do if you're a data person, right? But they've been great and have buy-in too. So we saw that there was a lot of phone calls that were happening, 20%. And that's a lot of times just reminders. Hey, meet me at the Reading Bears literacy group today. I just want to remind you. Text messages and direct messages too. I love this part of it. When we looked at the data, this was so impactful to me. So where they check the type of support the health champion provided during that one-on-one session, you'll see the number 1 category was informational. All of that, the information. Here's a flyer for a workforce program, right? But close second was emotional support. That was huge to me, because we knew there was isolation. We knew there were trust issues. We knew all of that stuff, but the data confirmed that the emotional support was so important. And that is one of the key reasons they kept showing up and kept engaging. And you saw that with Tina. She said, they became really close, her and Ashanti, over just a short period of time. But it was someone showing up saying, what can I help you with? Not someone coming in with a program. Sure, they have the things in the back of their minds, but they didn't do that. That's not what they led with. So I think that was a really critical piece for us. Yeah, next slide.
Okay, I'm going to walk you through quickly our structure. We're not nearly as far in the program as Jody in terms of a lot of things to share for outputs and outcomes. But basically, we ended up acting on that community priority of more trusted folks that speak our language. And we have 8 resident staff connectors that are representative of the families they serve. My staff speak Somali, Spanish, Arabic, Farsi, Urdu. So anyway, multilingual, multicultural staff. Like Jody was saying, their income they make is exempted from their rent calculation. And we ran the same numbers and found the same things there for those, who wanted to perhaps work a little more. Ours has a $500 monthly limit. And so we are able to at least pay them more. However, it definitely limits, we can't necessarily give them very much for raises, and also limits them to 25 hours a month. They're actually part-time hourly employees of KCHA. And so recently we advocated for more funding for this program for the current calendar year, and we promoted one of our connectors to a half-time benefited position as our lead connector. So we have that as well, more capacity now. In terms of structures have been so important. We've kind of learned along the way. My team meets on Zoom every week for an hour and a half. And they lead the program. We do a lot of our planning. What are we doing next month? What's our theme on Zoom? And so I use up breakout rooms. We do as much of interaction as we can there without necessarily having to meet in person. Because we serve 2 different areas, and it'd be difficult, especially with that time limit, to have people get together. We do get together quarterly. Next slide, please. We do get together quarterly in person. We have that coming up next week to do some more in-depth planning. Also, I meet with each and every one of the connectors for 30 minutes every week on Zoom. And so that's where we do some individual troubleshooting, what resources, might I be able to help you find. A lot of coaching, that sort of thing. But of all of those weekly team meetings are super important, because we use them as a team to collectively plan and collectively share ideas and support each other and troubleshoot. Who's having challenges? Okay, who's got ideas on how to combat those challenges? One of the things, the pivots we made, because we weren't able to do all the community level things we'd hoped to that you saw in the planning. Thank you. That's okay. We started bringing monthly activity bags and books to our families. And so our connectors started that last year. They choose the themes. They write up the activities. They translate the activities. So it's all of them. It's a lot of work to herd the cats to get this planning done. And also we have a yearly outreach schedule. So We focus on preschool in April, bringing applications, providing technical assistance, whether there be language barriers or technology barriers, to help kindergarten registration, parent-child plus, all of those programs that come up. We have kind of a yearly schedule of outreach as well. And then we do referrals to resident services or to other communities that we need. So next slide. I'm trying to decide right now whether we want to show our video or not. Okay. So yeah, I guess we'll end with a video and the tips and lessons learned. So just the hear from us after, because we're very close. So there's two different clips from a longer video that we want to show you. And the first one, I'll know it when I see it up there. So as they're working on the video, this video will show you some of our connectors, and it also has their experience, you know, as a resident, but also as a resident leader in the position.
As they're getting the video queued up too, you'll have a handout that you can take with you that really is like a resident leader readiness assessment, essentially. We came into this initiative in the middle of a big transformation in the neighborhood. So that's different than the way that they did this as well. So it's just some prompts to kind of get you going to see, is your community ready for this? Is your organization ready for this?
This has been an amazing experience for me, and you know, getting to know the families, and you know, a lot of times they say to me, oh, is this normal? My kid does this. I'm like, oh my gosh, yes, mine does that too. And they're like, oh, thank God, my child's not weird. You know, I'm like, oh, I thought mine was too, so I'm glad we have that in common. But yeah, basically, you know, if the families need any other kind of assistance that's outside of like the education scope, we also write referrals to them. And, you know, we have got connections with other organizations in the community that we can hook our parents up with if they have other needs besides educational needs.
But my favorite part I think about this is just having Leah. She's another mom. She's got, her kids are kind of similar, and so now we can bounce things off of each other. Like every time I see her, I work from home and she just comes and we just sit down and catch up and just get to know each other, and it's just really nice to have someone that I can talk to. I didn't have that when I first got here. I was just kind of shut in, and I'm still shut in, but Leah still comes by and encourages me to make friends and form bonds, and my daughter sees that, so that's awesome.
I've noticed that the Arabic speaker families I'm so close to, because they finally have somebody that they could talk to in their native tongue. And what's cool about this job is, like, let's say I don't have to rely on if only the wife is home or if the husband's home or if the kids are home, because I can connect with whoever it is, and they can ask freely in how, like, their native tongue, so they don't have to like hesitate.
And the connectors benefit as well from paid work, but also from strengthening community ties.
What I like about this program, so it gives us like chance, the people who doesn't speak English perfect or they don't have certificate, to contact with the family, to prove that like me, I prove myself, I prove my English skills. So also when you know that families speak Arabic, same your language, that's like make me so happy when I know like their neighbor live around me and I can contact them with Arabic. My kids also, we can keep my kids speak all languages.
The program creates all these different like prompts for us to like come together in ways that we probably wouldn't have thought about. We have all these items to center like moments of greatness around that we maybe wouldn't have ever considered before.
6 connectors currently serve a total of 175 kids. That means a lot of coordination of resources and supplies.
It's really just the little things that you see, like a text, you know, from a family forwarded to me from a connector with a child that just got new rain boots and he's dancing and he's so excited. Or a text from a mom that said, oh, this is the raincoat that I really wanted to buy my son, but I couldn't afford it, and I'm crying tears of joy. And these are all real stories from this program, and so it makes the hard work really worth it. All right, I think we're probably out of time. So what you're not going to see is how many families we're serving, blah, 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 for our program. You're welcome to stay after. We also had the tips and lessons learned, and I'm happy to stay after for that, but I also want to give those of you the opportunity to have your break. And I'm a big fan of honoring end times. So for those of you who want to stay and hear the rest, I'm happy to continue, but if you leave, it's totally fine. Don't expect them to be able to speak on everything. I mean, I don't want our Arabic speakers, we saw two of them there, to be able to represent, all of our Arabic families. It's more, when we hire, we just try to hire the folks that are like Jody's example is perfect. You look for those people. That's what you're trying to do in the interview, and getting to the barriers of our HR can be real difficult when you really just want that